In this video, I'm sharing with you 6 things you should know about spinal traction. These 6 tips that I'm sharing with you in this video should help you with low back pain relief and also low back pain recovery. Hey, what's up YouTube? It's Coach Remy here. In today's new video, I'm sharing with you 6 things that you should know about spinal traction. And these 6 tips that I'm sharing with you are things that I've learned over the past several years from my use of spinal traction for my own low back pain recovery, as well as what I've learned from working with a wide variety of clients who have used spinal traction and their forms of recovery, and also what the research says about spinal traction and low back pain. So without further ado, let's jump into this video. And before we jump into our first tip, I just want to explain what spinal traction is. Spinal traction is a method that can be used and applied to the spine in which we are creating a traction force on the spine. And a traction force is a force in which we're pulling things apart. So think of pulling the spine apart, and we're essentially destabilizing the spine in a way, but we're also opening up the spine if there's been a lot of compression that is built up. So this is a method that, if used strategically, can take perhaps pressure off nerve roots and give people low back pain relief, but it needs to be used strategically. So that leads me into my first tip, is that spinal traction can help with pain relief. So one of the things that I learned quickly from my recovery was that spinal traction was one of the best accessory tools that helped with my recovery. Anytime I jumped on an inversion table, I would get immediate low back pain relief. And to think of it from a traction perspective, if you take a spinal disc, and if you sit all day, stand all day, you get this constant compression that builds up within the spine. And what ends up happening is the disc bulges out, and it can cause, or it can put pressure onto a nerve root, and that can create pain. Now with traction, what we're doing is we're pulling everything apart, so we're creating a force in the opposite direction, and now everything opens up. And so now there's space between the disc and the nerve here, and that nerve becomes freed up. And that can provide low back pain relief because now the nerve might not be impinged for someone that may have a disc herniation. So if used strategically, it can be a nice form of pain relief, because when you apply the traction, that can create space for a nerve that's being impinged to move more freely. So that is the first big benefit, or at least tip with spinal traction, is that it can provide back pain relief for some people. And that leads me into tip number 2. There are different methods of spinal traction. So one of the forms of spinal traction that I used for my back pain recovery and relief was an inversion table. And prior to using the inversion table, I did have a physical therapist do manual traction on me. And now what I found was that the manual traction that the physical therapist applied to me manually, it wasn't enough for me to really see much benefit. And it wasn't until I hung upside down, full tilt on an inversion table, did I really get significant relief. And now, when it comes to different forms of traction, we can create traction in different ways, but we can also create a greater form of traction. So we have different forms, whether it's manual, so this could be from a partner or a therapist that can just kind of hold on your legs while you're laying down maybe on a table, and they can create a traction force. There can be also a form of traction, simply you can find at-home devices or equipment. Maybe it's you're hanging from a pull-up bar, or you're pushing up on a bench or a dip bar. That can be another form of traction. Or you can use a device like an inversion table to provide traction. There's many different ways to go about it, but what I would say is if you're working with a skilled clinician, they can be perhaps a lot more precise in applying traction to you, and they can figure out what would be most optimal for you. And that's the one benefit I would say that is involved working with a clinician, but at the same time, they might not be able to apply the degree or magnitude of traction that is needed for benefit per se. And that leads me into my third tip for you, is that the magnitude of traction applied to someone's spine, the benefit or the amount that is needed is going to be different for everyone. So when we think of magnitude, that's the amount of force or traction force we are creating. And we can increase the traction force or the traction effect via the amount of force or just the duration of the traction being applied. So for example, someone may hang upside down on an inversion table for a minute, or someone can hang upside down for 3 minutes. The person that's gonna hang upside down for 3 minutes will have a greater degree of traction applied to their spine versus the person that is only applying it for 1 minute. Now the magnitude is gonna be different for everyone because not everyone can tolerate, say 3 minutes of traction. Maybe only 1 minute is needed for benefit or 2 minutes. Everyone will be a little bit more precise and specific. And it's gonna come down to a bit of a trial and error process. And what I found was just me being a very tall individual, 6'5". At the time I was probably about 220 to 230. I don't think there was enough kind of force from the physical therapist applying the manual traction to my spine for me to really get benefit from. And once I discovered the inversion table and used that, that's when I noticed the full tilt benefit, because I had full body weight hanging upside down, kind of pulling on my spine, and that gave me some great relief. So that's my third tip, is just you have to identify the magnitude of traction that may be beneficial, and everyone will be a little bit different here. Moving to tip number 4, the benefits of traction tend to be acute. When you apply traction to your spine, depending on the amount of traction you're applying, the benefits typically tend to be short-lasted. And what I mean by that is, if you go hang on an inversion table for about 2 to 3 minutes, full tilt, the benefits of the traction you apply to your spine may only last up towards of maybe 20 minutes. And a lot of it has to do with what you do immediately afterwards and how much compression you're applying to your spine. So if you go hang upside down on an inversion table for a couple minutes, you get off afterwards, and say you go sit right away, those benefits will diminish rather quickly because of the constant compression from sitting, and things will slowly creep up and flatten out, creating that bulge again. And someone's back pain may come on rather quickly, but as soon as they go back on the inversion table, they will get relief right away because they're then opening up space. So keep in mind that the benefits tend to be acute, so it's important to be strategic with how you're using traction. And whether it's hanging from a pull-up bar, pushing up on a bench or dip bar, or just having someone manually apply traction or using an inversion table, keep in mind that the benefits tend to be short-lived, and what you're doing immediately afterwards is important. And so one of the things that I did with my recovery, just to give an example, is I would use the inversion table for a couple minutes, and then I'd go lie on my stomach for anywhere from say 20 minutes to 40 minutes or even longer sometimes. And as I found that this gave me a lot of relief and helped with the recovery process for myself. So just a little tip for you guys. Now moving on to tip number 5, traction can benefit nerve flossing. Now someone that is using nerve flossing as a method to free up an impinged nerve or to get relief from say sciatica or another just nerve that may be impinged, traction can actually improve an individual's range of motion when they do their flossing. So to give you an example, if someone has a nerve that is stuck, and if they apply traction to their spine, so say they have some compression that's built up just from maybe sitting and standing all day, and then they immediately apply traction for a couple minutes, they could free up a nerve root temporarily. And what that can do is that when they go do their flossing, that nerve can possibly move more freely along the spine. And it's not uncommon for someone to see an improvement in their flossing range of motion when they apply traction before doing flossing. So this is a little method that someone can perhaps apply and increase the benefits of flossing and increase the chances of a nerve perhaps being freed up if it is stuck or impinged. So that's my 5th tip, is that spinal traction can benefit nerve flossing. And then moving on to my 6th and final tip is that spinal traction isn't for everyone. And in some cases, spinal traction can make some people's back pain worse. And so using myself as an example, I've seen 2 ends of the spectrum where Traction helped with my recovery and also my back pain relief, but it also did create back pain at a later part of my recovery when I was kind of close to recovery or pretty much had made a recovery. There were instances where I had a significant sharp pain when getting off an inversion table. And to explain this, whenever you traction the spine, so when you compress things, everything becomes a little bit more stable and stiff when it's compressed, when you're creating a more compression force. Now, when you pull everything apart, you end up destabilizing everything. So everything being pulled apart becomes destabilized. So you're creating, in a sense, a little bit more instability. Now, if someone has some mechanical instability already present, and that can be from maybe a disc bulge, or maybe they have some osteoarthrosis of their facet joints, or maybe there's some other mechanical change of the spine, or maybe it's at multiple levels. When you destabilize the spine, when you apply traction to it, that can create perhaps a painful micro movement when engaging in the traction, or when immediately, say, standing up, or maybe just going into a high compression force right after the traction, because everything can kind of lock into place in an awkward way and can cause a sharp pain. And that was one instance, or there was a few instances, I should say, that happened to me when I hung upside down on an inversion table. Then immediately after getting off of it and standing up, I had a very sharp back pain where I couldn't move for about 30 seconds. And then eventually the pain subsided and went away. And so in those cases, people need to be very careful. And that would be an indication that traction would not be ideal for that individual, and to stay clear of it at the time. And they would probably want to build up some core stability first, so strengthening and building up endurance around the muscles that support the spine and give it more stability before engaging in a higher traction force, or more, maybe you're just lowering the traction force before engaging in a higher traction force as a way to prevent those painful flare-ups or micro movements to occur. So, final tip is that spinal traction isn't for everyone. It can be significantly helpful for some people, but it can also create back pain. So we need to be very careful with it, and it's not going to be universally applied and used in everyone's back pain case. So those are my 6 tips that I'm sharing with you regarding spinal traction, and those are 6 things that you should definitely know about spinal traction. And I hope that these tips, you can apply them to your everyday activities or life, or maybe implement them in your own back pain recovery and journey. What I would say, if you're uncertain about something, feel free to reach out to myself, or please seek out a qualified clinician that specializes in back pain and knows what they're talking about, and get their opinion and get help from them for specifics, and help them, or at least have them help you fine tune things for your own back pain situation. So that is a wrap for this video, guys. Now, before I just kind of wrap this video up, just want to mention, be sure to join the Facebook group, The Back Pain Warriors, on Facebook if you're looking for more back pain tips and more back pain advice from myself or other like-minded back pain folks. So with that being said, guys, have a successful and productive day. And until next time, take care.